Welcome to the Elixir Sessions, where we explore the cutting edge of wellness and innovation. We're joined by Dr. Zand, a clinical psychiatrist and spiritual healer. Dr. Zand is transforming mental health care with holistic approaches as the Chief Medical Officer of Better You and the founder of Anywhere Clinic. His mission is to make mental health accessible through at-home ketamine therapies and psychedelic treatments. Dr. Zand, great to have you with us today. Thank you for sharing your perspective on psychiatry and psychedelic medicine. Can you tell us about your background? How did you get into this field in the first place?
So I'm a psychiatrist, and I really specialize in holistic mental health, where we're deviating away from the traditional over-prescribing, over-diagnosing, and really trying to help people understand who they are from an area of self-exploration. And so right now I do a lot of work clinically. I still see patients. I am an educator. I teach psychedelic medicine and holistic psychiatry, and we have a telepsychiatry platform. We have a psychedelic therapy platform, and really just trying to find all the healing modalities to help people in their mental and emotional well-being.
What are the key differences between psychiatry and psychedelic medicine?
I think there are some similarities and differences between psychiatry and psychedelic medicine, but for the most part, we're really honing in on this is a journey. This isn't a one-time procedure. This isn't just one visit and things are better. There's not a problem we need to fix. It is a process to understand ourselves and really find the areas of our life that maybe need a little bit more harmony and balance. They need more attention, more nourishment. And so my job as a psychiatrist, I believe, is to give that tool to my patients so they can be their own therapist. They can continue the work and not always need me there. I have many patients who said, I'm going to be with you to the end. And I love that. I appreciate the continuity. But what psychedelic medicine has introduced is a much more accelerated path towards healing. I think we see these breakthroughs when we release the rigid concepts of our mind and we're able to open up and be more flexible. All the therapeutic work that we do really accelerates. And I can see somebody for 5-6 months, and finally when they're ready to do a psychedelic experience, it's almost like all the work we've done and has now come together and clicked for that patient, really cements and gains traction for their future.
How do you think psychedelics work so rapidly in overcoming trauma?
My favorite answer to any question about the brain or psychiatry or mental health is we just don't know. Right? We have to be honest with our shortcomings of the understanding of the brain. And I think as we learn more about the brain, we're discovering more about the mysterious parts of the world, of spirituality, of the unknown. And so how does it work? The mechanism of action is just very obscure. Hopefully one day we get there. But what we hypothesize is that we have this neuroplastic reset where the rigid patterns in our brain, these neural connections that are constantly ruminating, they could be fear-based, trauma-based, depressive patterns, anxious patterns, they live there in the background. Psychedelic medicine helps disrupt that to create more of an open, flexible mind state. So now when we do the work, it's not an uphill battle. We're updating the hardware of the brain so that when we get into therapy, we can then update the software. You can't really update the programming if you're working on old hardware. And I really feel that psychedelic medicine gives us that opportunity to refresh, renew, and see life from a new perspective.
How does plant medicine help people overcome trauma?
I do believe that if you've been through trauma, and we've all been through trauma, but you've been through things that were hard to process, they become stored in our brain, in the subconscious and unconscious mind. And when we do psychotherapy, we're really approaching the conscious mind, our understanding. And psychedelic medicine helps us to really go deeper and see the patterns that govern our decision-making, our behaviors, our feelings, and be that observer of self from a place of non-judgment, from a place of self-love and self-empathy. Because many times when I work with people who've been through deep traumas and we're doing therapy, they have so many false fixed beliefs and so many narratives that are just unshakable. With psychedelic medicine, we look at that same life perspective, but through a new lens. It's almost like the popular cliche, it's like Alt-Control-Delete for the brain. But the truth is, you really can't delete memories in the brain. The brain might repress them, but they show up in other ways, in nightmares and anxious patterns. And so instead of deleting difficult memories or difficult times, we need to reframe the narrative around it. We need to recognize that adversity creates resilience, that our story uniquely makes us who we are, even the tough times, and that if we can focus on that gratitude and that learning and make our mess our message, really lean into that work. This is what we call shadow work or subconscious reprogramming. We're leaning into those stories that live in the background and we're modifying them. We're updating them to make them more empowering and less debilitating.
What led you to get involved with plant medicine therapy?
In my psychiatric training, I've really been jaded by a lot of the archaic strategies that we employ. I think in 2018 I had a patient come to me and say, I left my last psychiatrist. I said, why? He said, he kept trying to give me ketamine. And I thought, that sounds reckless. Should we report this doctor to the medical board? And really, that opened up a whole new horizon because I started learning more about psychedelic medicine. And in 2019, we had an FDA approval for S-ketamine. And whereas in residency, I didn't learn any of this. I really feel that my own personal and professional journey through psychedelic medicine taught me how to approach mental health, taught me that we don't have mental illnesses that we're treating. We are seeking mental wellness. We can change the paradigm. It's not just you have this problem and we need to fix it. It's a journey in which we're helping create more self-compassion, adding more attention to factors of our life that are causing the upstream factors. I think traditionally in psychiatry, we focus on these downstream symptoms. I feel depressed, I feel anxious, I have no energy. But if you go upstream, you understand why that is. And it helps us introspect further in the biological components, the psychological, even the environmental and spiritual facets of life. And so my journey has taught me that from the jaded psychiatry work that I was trained on to now this beautiful psychedelic medicine work that really helps enhance the healing and the growth that we look for in our patients.
What are some of the biggest breakthroughs in psychiatry recently?
I believe that psychedelic medicine is the biggest breakthrough in psychiatry in the last 100 years. I just gave a keynote on the evolution of psychiatry, and we talked about all of the archaic strategies from electrocuting people to lobotomies, where we're chiseling away parts of the frontal lobe through the eye socket. I mean, the doctor who invented the lobotomy won a Nobel Prize. In 1949, that was revolutionary, but the mortality rate was 14%. And so we look at these strategies that were once heralded, and we look back now and we think, this wasn't it. And so psychedelic medicine, many caution, is this just the next trend? And I think it's not. It's here to stay because it didn't just come to invention. We've been doing this work for thousands and thousands of years. It has just now come to Western medicine. And with that, we're merging ancient practice with modern understanding, and I think that's really where we're getting the value.
What role do you think plant medicines played in human evolution?
Yeah, I think the mercurial question that connects all of us in humanity is, how did we get here? Right? How did this evolution happen? How did creation happen? We have maybe religious perspectives, spiritual perspectives, scientific perspectives, but it is an interesting one that some people think perhaps it was psilocybin or psychedelics that enlarged brain capacity, that expanded our mind and evolved us from maybe more prehistoric kind of thinking to a more refined computer processor of the brain. And if you look at the human brain, the prefrontal cortex, that's our computer processor. And when people do these psychedelic medicines, it lights up. It connects with other regions of the brain. It calms down parts that might be more fear-based, like the amygdala. And so creating those new connections, yes, creates this pathway towards growth. Evolutionary over time, is that maybe a reason why over hundreds and thousands of years we've evolved to have these bigger brains and these bigger prefrontal cortex? Perhaps. Of course, the answer really is we don't know. And the excitement is just learning more and more day by day.
What's your perspective on lab-created psychedelics versus natural medicines?
I think psychiatry in the past has been this trial and error field where we try a new medication, we check back in a month or two, see how it went retrospectively. And it's not the best practice, right? We're just throwing darts in the dark. Many of our theories, the serotonin hypothesis, was based on a side effect of another medication. And 70 years later, we're practicing these same strategies. I think psychedelic medicine has disrupted that. And it allows us to meet our patients where they are. And whether they want to go to a doctor and seek medical care, whether they want to go to a therapist or a facilitator, if you live in Oregon or Colorado and psilocybin is now legally used therapeutically, I think the key is meeting the patient where they are and not customizing this one-size-fits-all solution, because that doesn't work. We are all so uniquely individual, and every single person who presents with similar challenges has unique reasons as to why that is there. And who am I as a psychiatrist or a doctor to diagnose someone fully? I don't understand them fully, but the person that does understand them is themselves. This medicine unlocks the power to know ourselves better, understand our psyche, and then become our own healer.
How can we create greater acceptance of psychedelics in mainstream medicine?
I think it still requires a lot of safety, our industry of psychedelic medicine. If the doors are wide open and everybody becomes a psychonaut, a huge part of that population may seek benefit, but some of them might actually be traumatized further. And so for the person who's ready to engage, maybe they have that comfort and that support in their life to seek their own healing, great. For those who really want medical supervision, I think it's important that we have medical reviews and psychiatric reviews. And so the government being the body that helps regulate and protect us from harm, I think the intentions are right, but we also know that maybe the motivations and the lobbying that's done isn't always for the best reason. So we have to take every modality that a doctor offers and question them the same way we would question the person who says, you know what, we can do this underground treatment. I don't think just because it's medically legal means it's safe, and I don't think just because it's recreational means it's unsafe. We have to find that sweet spot and really just provide that comfort, that compassion to each other so that when we're going through these journeys, our mind is in a safe place, our body is in a safe place, and we can really impact the benefit we're looking for.
What do you think some of the most promising use cases for psychedelic therapy are?
Right now in psychiatry and psychedelic medicine, we're a little bit limited because we have to follow the rules of diagnostic criteria. You have to be diagnosed with a mental illness, and I don't agree with any of that, although I play by those rules. I think once we understand we all can deal with depressive issues or anxious issues, then we start to look at real life situations. Someone who's lost a loved one, of course they're going to be depressed. That's normal. They should feel sadness. They should feel all those stages of grief. But if they repress those emotions, then they're not healing through it. And so psychedelic medicine is fantastic for grief, for trauma. I think transition points in life, somebody who's lost their job, somebody who maybe is incarcerated or just came out of the prison system and now they have to reacclimate in society. Creating this platform to expand our mind and get away from those patterns that were really causing a destructive feeling for us, now we have this new opportunity, this blank canvas. And so from acclimating back into the normal society if we were in the military or in the prison, to couples counseling and family dynamic healing. There are so many applications. We do corporate wellness retreats. We actually even focus on adolescents who might be suicidal, and the alternative is I'm going to go to an antidepressant and maybe it works in 2-3 months. If they have good care in their life and both parents support this work, we work with children too. I think we need to open up our minds to all of the possibilities and get away from the rigid constructs of diagnostic criteria. That's what I'm excited about in the future of this work.
Dr. Sam Zand's holistic vision for mental health care is both compassionate and revolutionary. His work offers hope and healing to so many. Thank you, Dr. Zand, for sharing your transformative approach with us today. See you on the next Elixir session, where we uncover unconventional wellness leaders doing amazing things.